I feel like I have deja vu. You guys ready? Well, good afternoon. It's been a while since we've had a press conference in here. We may unfortunately have to do so again more often moving forward, and we'll certainly set it up again so that more COVID-friendly in the future. As I said on Friday in a couple interviews, I'll just repeat, I feel like with the wonderful news about the vaccines today and a couple weeks ago, that we finally see the light at the end of the tunnel. And we are going to get to a vaccine and herd immunity. And I feel like the analogy could be, as I used last week, D-Day, that after D-Day, in retrospect, it was clear that we were going to win World War II. But it took another year and a half, and tens of thousands of people died between D-Day and the end of the war. And that's kind of where we are now, where the end is clear, but there's an enormous amount of danger between now and then. And when you think about all the things we've been through this year, the caseload is much higher and growing much faster all across the country than any time in the past. Now, we're smarter. We know a lot more than we did in March and April. We know it's airborne. We know masks make a huge difference. We know that we have figured out how to do our best to live with the virus and work with the virus. And those are all good things. But right now, we have to figure out how to slow down, engage in less gathering right at the moment of heading into the holidays when people want to do more gatherings. So to that end, we want to lead by example, and I mentioned on Friday, but signed a number of executive orders today that will, through 2 weeks past, starting today, but 2 weeks through the end of Thanksgiving weekend, shut down City Hall to the public, put a temporary halt to the public meetings, city council, committees, hearings of that sort. The manager and myself can give a waiver if there's some urgent issue that arises, but fundamentally, we know that there will be people who engage in social networks that are beyond their bubble, which puts everybody in danger. And so those of us who come into City Hall, those who will work together, those who come into a public meeting, it's just increasing exponentially the potential of 6 degrees of separation, if you will. And so sort of taking a pause for the next 4 weeks and waiting out to see if the numbers are getting worse or starting to slow down as this awareness is daily now across the state and across the country. And maybe we'll see where we are, at that point in time. And there will be some critical public issues that have to be resolved in mid-December. So we will have meetings again this year, but we'll try to limit them to the extent possible. I will be working from home 3 days a week as best I can. Obviously, I can come in if necessary. And so we want to lead by example with encouraging people to do as much remote work as they can. This is the critical time when we're are both excited about the light at the end of the tunnel, but the danger between here and there. So with that, I'd like to ask Commissioner Melba Moore to come forward and say a few words about today's reports and where we are. I know it's been a while. And then after her, the city manager, and then I have a special announcement at the end of that, and then we'll take questions. Thank you.
Thank you, Mayor Cranley, and good afternoon, Cincinnati. Today, November 16th, we have 218 positive cases of COVID-19. So when you think about those new cases, you see our highest case count was on Saturday with 247. Next slide, please. That brings us to a total of 9,659 cases. A couple of weeks ago, I started watching the 10 to 19 age range, and you see there's 1,069 there. Well, it's been constantly increasing. But the other number that I'm watching is at 0 to 9 age range, which is with our younger children. But nonetheless, the 20 to 29, 30 to 39, and our 50 to 59, those numbers keep going up, keep going up. And I bring that to your attention because children, many times, are with grandparents. You heard the mayor talk about getting to the light at the end of the tunnel. We can do that. Each one of us can do that and have a huge impact. And it's the sacrifice to do the right thing so that we can be ready to receive the vaccine when it comes. But we got to get there first. Next slide, we have total cases, and this is as it relates to the age range, that median age of 33. Current hospitalizations, 55. We heard from the hospitals on Friday. They rang a bell, they're sounding the alarm. The more cases in impacts the number of healthcare workers in that setting. We can do this, Cincinnati. We have to work together. Next slide. Total hospitalizations. Total hospitalizations are 678. There you go. Total hospitalizations, 678. So within that 14-day average, we're seeing about 11.5 cases. That's the hospitalization rate, 11.5. And the median length of stay is about 5 days. Next slide. This is a slide that we really don't want to talk about, but this is the slide that the mayor was describing in that analogy of D-Day. We have 125 deaths, and our case fatality rate is 1.3%. Next slide. 5,135 have recovered. Next slide. So you look at that current trend. We see we're averaging 151 cases within a 14-day period. And again, that highest number that we saw was on Saturday at 247. Total hospitalizations within a 14-day period, we're averaging about 2. And as I just shared about the deaths, we're averaging about 0, but that still is a case fatality rate of 1.3. Next slide. So now we're looking at our neighborhoods, total cases and where they are. If you remember when we met this summer, we talked about this. Westwood, you see there. You see in our Clifton neighborhood of where those cases are. So when you think about the neighborhoods, you think about what's there, right? So we know our young people are back at school in our universities. And when we look at the next slide, now you see total cases by zip code. 45211, 45238, 45202, 45221. So when I say that, I might sound like I'm talking fast, but I want you to really just let that marinate. We all live within one of those zip codes. Model the behavior. Continue to talk to your loved ones and your family about what we individually can do. Wear a mask, socially distance, sanitize frequently, and take advantage of the testing that's made available through the Test and Protect program with the Health Collaborative. Help us help our healthcare workers. Thank you.
Thank you, Commissioner Moore. That report reminds me of how fortunate we are to have such dedicated public health professionals working in our health departments. As Commissioner Moore stated, the rise in cases is of serious concern to us, and it necessitates certain changes in City Hall. And so we are taking steps to put in place some plexiglass barriers in different locations, including in City Council chambers. We will be putting into place air purifiers with filters that will help protect us against the airborne nature of this virus. Our employees will be working at home to the extent that they can. Remote working is encouraged. Those employees that do come to City Hall will continue to have their temperatures taken. City Hall is closed to the public, so it is only open to employees and public officials. There are, of course, employees that cannot work remotely, and our deep gratitude goes out to those frontline employees here in the city. That is police, fire, public services, sewer, water, and healthcare workers, and outside the city as well, those healthcare workers, grocery store workers, food service workers, retail service workers. We are deeply grateful to them as well. Thank you.
Before we get to questions, I have a special presentation that I'd like to make. Obviously, this has been an extraordinary year. The most difficult that I've had in elected office, either as a city councilman or as mayor, dealing with multiple crises at the same time, COVID, recession, furloughs, budget, racial injustice, gun violence. And, 2020 for all of us and for our families has been an incredible toll on us personally and as a city and as a community. It's also the case that among many other sacrifices that we are taking, which are much more serious sacrifices, my annual State of the City speech will be virtual this year and be prepared in the next several weeks. And so it'll have to be done differently than in the past when we would all gather together. But a tradition that I started 7 years ago that continues this year, where I identify, among others, Humanitarian of the Year that helps us get through the most difficult human tragedy each year, is an award I give out, and then we place the winners on the wall of the mayor's office, which I hope my successor, whoever that is, will continue, and we will continue to honor as a tradition moving forward. And so it is with great honor that this year I am awarding Health Commissioner Melba Moore with Humanitarian of the Year 2020. So you can come forward.
I have to do this. Thank you.
Say a few words.
You know what, when I took this job, I was excited about being the health commissioner for this city. But I never, ever dreamed that I would be facing a pandemic. And every day I just went through and do what I do all the time in trying to lead us through this pandemic. I couldn't do this without my team. One of my teammates is here, Dr. Amin. I couldn't do it without the city manager and Holly, all of you, but it's because of Mayor Cranley. I never want to let him down. I want to let him know that I'm here to shoulder this with him. And we will, Cincinnati, get through this. And Mayor Cranley, thank you so very much I never saw this coming. I did not see this coming. Thank you. Thank you. I'm honored. Thank you.
Well, Melba, we could not have made it through this year without you. And, you know, there are some people who believe, rightly or wrongly, that if you weren't born and raised in Cincinnati and didn't go to a high school that can be named at the top of your lips, that it's hard to break in. And while you're now a proud Cincinnatian, you know, you're relatively new to town. And it's incredible what's been thrust upon your shoulders and the difficulty of throwing you into the midst of a cutthroat political situation as well as City Hall in general, but then add to it the pandemic. And you have been consistent, graceful, hardworking, and operate with integrity and adapted to changes throughout. And because of that, our public health department and tradition of a public health commitment of the city, which is unique among major American cities, has shined ever brighter. And so you have made a huge difference for our city, and I want to congratulate you again. With that, we'll take any questions. Yeah.
Governor spoke about additional options possibly tomorrow. One of the things that is floated out there is the possibility of an overnight curfew, a week from Wednesday, biggest bar night of the year usually. And I'm wondering if you think that a curfew statewide would be then.
Well, we'll see what the governor comes up with. You know, depends, I guess the devil's always in the details. I mean, for example, you know, a lot of Kroger's are open 24/7, and I haven't done this in many years, but I remember when I was a bachelor, I would occasionally go shopping at midnight or 1 in the morning, and not a whole lot of people were there, and it probably the safest time to shop and be physically or socially distant. And so, would the worker, if there was a curfew, would the workers be furloughed? What economic impact would it have on them? And then would it not then just bunch in and make it less likely to be physically distant, you know, between, say, 6 a.m. and 10 p.m.? So, you know, every action has a reaction and unintended consequences. So I'm going to keep my mind open. I wouldn't rule anything out or in, but certainly we'll wait to see what the governor has in mind.
Mayor, did you have an opportunity to hear the two council people with their press conferences today regarding corruption in the city? And if so, what are your thoughts?
Well, I commend them for the spirit of reform. As I mentioned last week, you know, and there's a picture of Murray Seasongood in my office, as there are of every mayor in the history of the city, and I think he's rolling over in his grave. And if you think about the great tradition of good government in this city that he helped usher in 95 years ago, that was focused, as it was nationally at the time, but we were the leader at the time, on reforming the patronage system and government jobs in vital services, whether it be public health, whether it be police, fire, garbage collection, et cetera, as merit-based civil service protected, so that it wasn't about who you knew if you could do a job of a police officer. It's whether or not you have the skill set to go into harm's way and be able to protect people in a professional way. And I believe that those changes did lead, and have led, by and large, to an executive branch of the city of Cincinnati that has been remarkably corruption-free over almost 100 years. Those changes, which were not geared towards city council at the time, was in part because for a very, very long time after 1925, council was very part-time and, you know, didn't get paid for a long time, or was paid a nominal amount. Obviously, the horrible tragedies, alleged crimes, one of which has already been pled guilty to, the other one seems pretty bad, we're in the legislative branch. So I think it's good that we have two legislators who I believe are not engaged in those criminal type behaviors, are leading on this, because rightly or wrongly, people will associate the whole body with the actions of two. And that's obviously not fair, but I think in interest of the public good, those kinds of reforms, in the spirit of reform, is exactly what we should be doing.
Just quick follow to that. Betsy Sunderman said Cincinnati is quickly gaining the reputation as one of the most corrupt cities in the country. It's a travesty of government and an embarrassment to our city. What are your thoughts as the mayor of that city?
Well, again, I wasn't there for the press conference. I can just tell you that the administration that you just heard from, the city manager, the health commissioner, myself, and the 6,000 hardworking professionals in the executive branch of this city act honorably, with integrity, with civil service protection, in that spirit of reform. And the two criminals that have been arrested have been from the legislative branch. So it certainly makes sense for Councilmember Sunderman to be focused on the legislative branch, since that's where the two most recent problems have come from. But as I said last week, this all breaks my heart. It's not good. It's not fair, most importantly, to the public, but it's also not fair to me. It's not fair to the manager or to the health commissioner. I've spent the majority of my professional adult life making the city better, and I think it is getting better. And so I don't like being associated with two independently elected officials who don't work for me, who engage in criminal acts.
Sorry, and one last question. You're proposing closing down meetings, at least for the next month or so. These council people want to get this passed by the end of the year, these reforms. How's that going to affect it?
Well, my understanding is that some of their reforms are charter amendments that would require going to the vote of the people. And they've missed a deadline. Obviously, we had an election 2 weeks ago, so it would be for the primary next year or the November election next year, which we have plenty of time to do. But having said all that, as I said earlier, there's no doubt in my mind that in addition to this ethics reform, we are going to have additional council meetings in this calendar year. There's other vital business, of the city that have to be passed. But right now, we want to deal with this COVID surge and make sure we have the infrastructure in place to be as safe as we can. Yeah.
Yeah, so, I know you guys you said you're leading by example with, working remotely, things like that. Should people expect more businesses or other parts of the city, to do the same, or expecting the following year to possibly see more shutdowns like we saw months ago?
Yeah, I think at the moment, every business needs and should do what they can to limit the exposure of people together physically. So, for example, Fifth Third, had announced that they were bringing people back downtown, and then they put that on pause as that caseload surged. That's not something that we want to do. It's not something I want to do. And I was excited when Fifth Third was announcing they were bringing people back downtown, because we need to repopulate downtown. But unfortunately, the virus is surging again. And as inconvenient as it is, I think it was wise for Fifth Third to put that a pause in place. And I think other companies can and should do the same to protect their workers. I'm sorry? Oh, there are people on the phone. Business Courier, do you have any questions?
I do. I missed that last question, but maybe something similar. What has the reaction been from the business community about your call Friday to have employees go remotely?
Well, I think similar to what I just talked about related to Fifth Third, who, a month ago said they were bringing people back downtown, but then as cases surged again, they put that on ice. And I think we're going to see that as a trend across fields until this winter of discontent is behind us and the vaccine is in front of us. Channel 19, Fox, are you on the phone?
Yep, can you hear me?
Yes.
Great. Right now, are there any plans to have alternate care sites or hospital beds in the Duke Energy Convention Center or anywhere else in the city for that matter? And then also, would a shutdown of restaurants and bars by the governor have any effect on the city's $4 million stimulus plan announced a few weeks back?
Thank you. Good questions. I should have mentioned, but I want to go out of my way to mention that Hamilton County Commissioner Denise Treehouse has restarted our weekly calls, including health commissioners and interested party stakeholders, healthcare providers, to make sure that we're in constant communication. And we had a call today. And in that call, we talked about the whole issue related to Duke and the convention center and spillover. And I'm happy to report that as bad as the numbers are, we don't believe that's necessary at this time. We think we're a long way from that being necessary. And as the hospitals have been able to show extraordinary collaboration, cooperation over the last 6 months, they believe that they have internal solutions before needing to go to Duke. If we go back to Duke, that's really bad news. And at the moment, people don't think that's going to be necessary. You know, as it relates to restaurants and bars, if, you know, let me just say it, as I've said before, that I believe that food, like Kroger, is essential, and the work and the jobs that are at stake are essential. And, you know, I think we've got to learn to live with this virus, and so I hope that no decisions will be made to further impair industries that have already suffered a lot throughout this year. But having said that, if the governor, as he said explicitly last week, does close in-dining restaurant, bars, and fitness centers, no, that will not affect our stimulus plan, other than it will become more vital to many of the restaurants that qualified. And remember, we limited the eligibility to restaurants that were dine-in, meaning that they had dining capacity. We're not telling them they have to remain dine-in during the pandemic. They may decide for safety reasons they want to be carry-out only. But we explicitly excluded drive-through restaurants, which have not been hurt as badly as dine-in restaurants have been throughout this year. WVXU, do you have a question?
I do, yes. You talked about changes happening at City Hall meant to protect staff there and elected officials and representatives. Are there changes happening anywhere else in the city? And could the city of Cincinnati have any sway in changes that happen in the city to protect workers like grocery store workers or, like you were saying, the police officers or firefighters?
Well, I mean, and we can add more if the manager wants to, but we are, you know, spacing out roll calls for police and fire and trying to be intentional about adopting the best safety protocols. Manager, I don't know if you want to add anything to that.
Good afternoon. Each department submitted an emergency operations plan and a COVID plan at the beginning of the pandemic to ensure that their employees could continue to perform their jobs safely and with the appropriate protocols in place. And we have asked them to provide an updated plan for this time when the cases are on the rise. Even though those plans have not yet been submitted, certain things remain in place. There is a mask mandate. All employees are required to maintain a social distance of 6 feet, a physical distance of 6 feet. And we continue to operate on kind of a remote workforce, a scaled down workforce throughout the city. So a lot of the appropriate measures are already in place, but we will be updating those plans so that we can ensure that we are doing all we can to keep people safe.
All right, thanks, everybody. Have a good day.